Elise Krause is a typical 2-year-old full of energy. She loves to laugh, likes to feed herself Cheerios, and with the help of her dad likes to sing Twinkle Twinkle Little Star. But on the inside, Elise is anything but typical. On this day, she and her baby doll Sarah are both getting wristbands at Children's Hospital. Elise will have her height measured and her weight checked because she's about to get her bi-weekly dose of chemotherapy. It was about 2 years ago, when Elise was just 6 months old, that her parents wondered if she'd ever run around. Doctors found a massive brain tumor, so she underwent 2 surgeries right away, but the worst news was still to come.
With the surgeries, they got it all. Great, and then all of a sudden they're like, well, she's got this type of tumor that comes back. And then it was like, whoa, wait a minute. So this can keep coming back, forever.
Telling us exactly what type of cancer it was, that it was a very aggressive cancer, a grade 4 cancer, and that this is the cancer that will take your daughter. And they said it's not a when, it's when this will take her, not an if.
It's called glioblastoma. It's an extremely aggressive form of brain cancer that is most common in older men. These scans show the space that's left in Elise's head since the massive tumor was removed. Doctors haven't had much success in treating glioblastoma, so for the last 1.5 years, Elise has been part of a drug trial. She has a port in her chest that allows nurses to give her chemotherapy twice a week. It involves 2 different drugs and takes about an hour, but once the tubes are in, she's back to her typical 2-year-old self. On days like this, you'd barely know there was anything wrong, but on days like this, the seriousness of Elise's condition sets in. Just 1 day after chemotherapy, Elise is back at Children's. She just had a CAT scan and is now getting ready for an MRI. You can't move at all inside the machine, so she's been sedated. Daddy Steve sits inside the room just in case.
I know I'm not a medical person, a doctor, a nurse. I can't go in and help out if something is happening, but I can just be there.
As parents, most of us feel like soldiers for our children. But going through this with your baby girl is like fighting a war.
It's tiring and exhausting, and sometimes, both of you can't go to the clinic. Someone's sick, someone's hurt, someone needs to continue on at home.
Doctors are keeping a close eye on a spot that's shown up on scans for the last 1.5 years. It could be scar tissue, it could be tumor. These tests should help decide. Elise is groggy now, but in a matter of just a few hours, Elise surprises everyone with her energy. It's been a long day at Children's, but they are waiting for her doctors to analyze those scans. While an intern looks her over, Elise's pediatric oncologist, Dr. Sach Jogel, shares some very good news. He tells them he doesn't see any evidence this disease has returned.
And that's very reassuring, because in most cases with this cancer, the tumors tend to come back if they come back within that time.
And as for that spot on her MRI, Dr. Bruce Kaufman is Elise's neurosurgeon. He doesn't see a reason for more surgery anytime soon. It is exactly what Steve and Kate wanted to hear, but their joy is subdued, their optimism is cautious, because they know this cancer often comes back.
I'm always going to be a cancer mom, so, that's my role, that's who I am now.
As parents, they will stay strong because they have to for Elise Kate says she doesn't allow herself to think about the future. She stays focused on the here and the now.
I hold her tight. I make as much time as I can for her. It's like, okay, the house is messy. I don't care. You know, it's like your priorities definitely change.
But there is one thing they do think about, and that is a future free of this disease. Not just for Elise, but for other amazing kids just like her.
You know, providing money for research to cure these cancers would be, you know, the answer to our prayers. How I wonder what you are. Good song.
Good job.